In your Clinic Manager account, you can create, store, and manage records about patients' visits to the doctor. To create a new record about consultation, click the Consultations item in the Patient Summary on the left, or select the Consultations from the Patient Summary drop-down list at the top. What you see here is the list of already existing patient consultations records in the system. To create a new consultation record, click the New button above the list. The page to create new record about patient's consultation consists of several tabs. Each tab is designed for entering certain information. On tab General, you can enter main information about patient's visit to a doctor. You can enter the name of the visit and indicate its date. By default, this field is always pre-populated with the today's date. To change it, just click the small arrow next to the field and select the appropriate date from the calendar. Also indicate the name of the consulting doctor. The Vital Signs tab is for entering information about changes of patient's vital signs. During patient's visit, you can take measurements for blood pressure, beat frequency, rate of respiration, height, weight, BMI, and so on, and indicate the values on this tab. Please note that if a patient suffers from hypertension and he or she is 18 or older, you will be notified of the necessity to measure blood pressure during patient's visit. To read your notification, please hover your mouse over the clinical reminders, which is highlighted with the red, and then click the hypertension link. Read the information in the pop-up window, then close it, measure the blood pressure and enter the appropriate values in the fields. After you enter blood pressure measurement values, this notification will be marked as performed and highlighted with the green color. Tab Chief Complaint contains text field to enter information about patient's chief complaint. You can enter the description text to the multiple line text field on this tab. On the tab Subjective, you enter information about patient's certain complaints. You can enter complaints per yourself in the text field Subjective, or you can use one of the charting templates created before. The list of charting templates is on the left. These templates are taken from the charting templates library that you have created earlier in the system. To learn more about how to create a new charting template, view the appropriate tutorial. So, in order to be able to use one of the template elements to describe certain patient's complaint, you need to select the appropriate template. Just hover your mouse over the charting template you need and click on it. After you have selected the name of the template, you will see the list of template elements. You can select the required value, hover your mouse over it, and click on it. It will automatically be moved to the field with the description. To go back to the list of charting templates, just click the cross icon at the top of the table. On the Objective tab, you can enter information about patient after pre-assessment, which means information about conducted diagnostic manipulations, such as, for example, reflex check. You can enter this information yourself in the Objective text box, or you can use one of the charting templates created before. Work with charting templates in exactly the same way as it is described for the Subjective tab. On the Assessment tab, you can enter information with evaluation of patient's condition based on patient's complaints and pre-assessment results. You can enter the conclusions about patient's health condition obtained during analysis of patient complaints and other diagnostic manipulations, either by yourself, by entering information into the appropriate assessment text field, or you can use one of the charting templates created before. Work with the charting templates exactly the same way as it is described for the Subjective tab. To create a record about patient's new diagnosis discovered during this certain consultation, click the New button in the Diseases section. When creating a new patient disease under the Assessment tab, first of all select the diagnosis. To do this, click the Select icon next to the Diagnosis field. The Diagnosis pop-up window will be opened. What you see here is the list of all diagnoses stored in the system already. As far as the list of the diagnoses is too long, you can always use the search panel to find the information you need. Just type in the code or the name of the diagnosis, full or partial, and click the Find button. Your search results will be displayed in the table below. Select the appropriate one, hover your mouse over it, and click. The pop-up window will be closed, and the name of the diagnosis will automatically appear in the appropriate field. Fill out all other required fields with the information and click the Save button. If you want to add record about a diagnosis that was discovered earlier before, and there is already a record about it in the system, you should click the Add button. In the Patient Diseases pop-up window, you will see the list of diseases already discovered for this patient and stored in the system. Select the appropriate one by ticking the checkbox next to it, and click the Select button. The tab Plan is for entering information about procedures planned for patient's treatment. You can enter treatment plan by yourself in the Plan box, or you can use one of the charting templates created before. Work with charting templates in exactly the same way as it is described for the Subjective tab. You can also enter the names of medications prescribed for the patient in terms of the certain treatment plan. Click on the Manage button in the Medications block to select the medication from the New Crop pop-up window. Tab Quality Measurements Report is for entering summary information for the patient's visit. Entered information will be used to calculate clinical quality measurements, and then will be used to generate clinical quality measures report. In the first block, you can indicate the type of the visit. In the second block, you can view information about blood pressure measurements. In the Tobacco Use block, you can indicate whether there was a consultation for patient during which he or she got recommendations to quit smoking. In the Weight Screening block, you can view information about height, weight, changes, and calculated BMI values. You can also indicate the reason why BMI calculation hasn't been conducted. You can always export your patient consultation in either an XML or PDF format. To do this, just click one of the appropriate buttons above. After you have entered all the required information in all the tabs, you can click the Save button to save your consultation. You will see a newly created consultation appearing in the list of patient consultations. It will be highlighted with the gray color for your convenience. You can always edit or delete the record using the appropriate icons next to it. From the Patient Consultations window, you can also generate a patient survey list diagnostics report. To do this, just click the Get Patient Survey List Diagnostics icon next to the record. If patient was diagnosed during consultation some disease that should be reported and stored into the system, you will see the window to store file with the report. If there are no such diagnoses, you will also be notified. For more information about how to use Clinic Manager and how to work with other patients' medical data, view our other tutorials.